Well, my name is Karen Douglas, and I worked for the Postal Service. I was a mail carrier. I delivered mail. I was just walking with a tray of mail, stepped off a curb, and jolted my back, and didn't notice for a little while after, and then I began developing what I thought was a hamstring injury. Turns out it was sciatica. A few days later, I went to the doctor. They did an MRI and found that there was, a problem with L4, L5, and sent me to an orthopedic doctor, an orthopedic surgeon. That surgeon sent me through lots of things. We first did rest, and then physical therapy, and then traction. We graduated up to epidural. We have first cortisone shots and then epidurals. All the while I was taking pain medicine and muscle relaxers, not realizing how addictive they are. And about 8 years of epidurals, about every 3 to 4 months. I think I had 14 epidurals, and an epidural failed. The person who gave the epidural punctured the epidural sac, and I leaked spinal fluid. So they said, no more epidurals for you, you're done. And in 2008, that's where I was left with just medication to try and hold back the pain of these two discs that, two discs at that point. I didn't realize the second one, L5S1, was also bulging. When I would do the MRI laying down, they never saw them. But once I walked in here and Dr. McCord said, well, let's do this, an upright MRI, that's when the whole problem was seen. Back in 2007, I was placed with a physiatrist, which is just pain management. Lots of oxycodone and lots of soma. I think I was addicted to soma when I walked in here in 2010. June of 2010, I had a friend, and she used to come here to Dr. McCord, and she said, hey, try my doctor, maybe he's got something other than medicine that he can offer to you. And I walked in here, we did the upright MRI, and within 2 minutes of looking at my MRI, Dr. McCord was sure of what I needed to do, and that's to have this surgery. Go ahead and fuse the spine and go on with life. And so then began my journey. This was a work comp issue, so I fought work comp, constantly all the way. We requested surgery in June. In September, they sent me for a second opinion. This doctor opined that I didn't need the surgery, that I needed to be permanently disabled on medication for the rest of my life. And then after he permanently disabled me, on that paper, I began a fight for my job. Working for the post office, I loved doing my job. I loved delivering mail. I loved the customers that I had. But when he wrote those words, permanently disabled, I began a fight for my job. Through many months of just sitting there taking, trying not to take medicine really, and I was sitting at home then. I was no longer working. We fought back and forth with work comp. Work comp would constantly have me go see other doctors, go see, they would just deny, just flat out deny procedures that Dr. McCord would want to use to prove that I needed this surgery. Back and forth with work comp. We requested again surgery. They denied us again. I sought a lawyer. The lawyer requested surgery, and they again denied it. I was pushed into what I felt was my only option, which was retirement. And I was warned of this from the beginning, that I would be forced into retirement. And as that began happening, and I could see that coming, it began a desperate fight. And I was willing to, just try anything. Whatever they wanted, I began trying to work with federal workers' comp, which is impossible to do because they're constantly, they are not going to approve this surgery for me, is what they told me. I ended up in 2011, I ended up in the hospital, just severe pain. I could hardly even just tolerate it. I began having problems with continence. You know, I was incontinent. I couldn't even feel that I was going to the bathroom on myself because of the nerve pain was so intense. Dr. McCord placed me in the hospital to try some pain management, to try to see if we could get work comp to approve surgery. And they told Dr. McCord that we will never approve this surgery for her. And they didn't. They never, ever approved the surgery for me. In 2012, March of 2012, I lost my job. I no longer was under the Postal Service. You know, I was under, I guess, myself. I still was getting work comp, but unfortunately, they were not going to approve this surgery. We requested it through my medical insurance, my personal insurance, and they denied it because it was a work comp issue. And so began a fight with, you know, in between the both of them, and I didn't have enough money to fight either of them, you know, but Dr. McCord just never gave up. He never gave up. He called senators, he called Congress people. When I was in the hospital, I remember he visited me late one night and said, well, I just got off the phone with a senator, and he's going to try and help us. Unfortunately, with federal workers' comp, the Department of Labor is pretty much God, and they don't answer to anyone. They just, I guess they're bigger than even senators and Congress people can fight. So I gave up. And I was done. I don't know how it came about that Blue Cross Blue Shield, my personal insurance, said, what's going on with this person? Why is she taking, you know, why is she having all these problems? I gained 30 pounds, you know, sitting in a chair for 2 years eating chips. I gained 30 pounds. I began to have high blood pressure. I was taking 4 Aleve 3 times a day, which I was medicating myself. A doctor never told me to do that, but that's the only way that I could somehow keep, you know, the pain from I guess, to keep from overcoming me. And I give myself an ulcer. So here I have high blood pressure and ulcer. Now I have thyroid problems. I've killed my thyroid, I guess, with all this medicine that I was taking. I was no longer on the Soma, thanks to Dr. McCord. When I first walked in here, he said, I won't prescribe that for you. And I praise God that he didn't, because I think I was addicted to it. And I think it would have been more hazardous to me had I remained on muscle relaxers that long, those kind of muscle relaxers. So I attribute that, you know, of me not being addicted to Dr. McCord. But having someone on your side is just, it was the biggest blessing of all. When I walked into Dr. McCord's office the very first time, he told me my symptoms, and I started crying. I said, yeah, you believe me, that's what I'm going through. I mean, from the very first moment, he knew what was going on with me. So I've always believed in him. Work comp sent me to see a third opinion doctor. He was supposed to be a referee for Dr. McCord, between Dr. McCord and this second opinion doctor. And he more or less called Dr. McCord a monster. Said that he just loves, you know, to put people under the knife, and if he does this to you, you're gonna be absolutely permanently disabled. You'll never walk again. And that's not the truth. I do more than walk now. You know, I'm back to hiking. I walk my dog, which was the most thing that I just set out. You know, I told Dr. McCord when I first come in, I just want to walk my dog again. You know, okay, if I don't enjoy all these things that I used to, just can I walk my dog again? Boy, I wear that dog out. I walk him a lot. We go hiking, you know, we just have a good time together. And my husband, I was complaining about my scars the other day, and my husband said, you know, those scars are beautiful in a way, because think of your life before, you know, before you had those scars. And you know, those scars mark a certain time where you were given your life back, you were given hope back. And you know, I attribute all of that to Dr. McCord. He never gave up on me. In 2 years of literally just fighting and being denied and being told, you will never do this surgery on this person, he never gave up on me, never. If there was any glimmer of hope throughout it all, and the only reason I never gave up was because Dr. McCord was constantly saying, no, this is gonna work. We're gonna get this approved. And he always had belief that we would. And sure enough, you know, through my personal insurance, we were able to get it approved through them. And here I am today, having gone through the surgery. You know, the very next day, I had the surgery on a Thursday, on a Wednesday. I woke up on Thursday morning and they removed the catheter from the surgery, and I got up and I walked, and I already knew something was different. I was upright. I could just feel that I had been changed. It was like a miracle, even though I knew, you know, this fusion is what did it, but he got me upright. He got the nerve off of, or the disc off of that nerve, and I was walking. And I walked round and round that day, just the nurse's station. I know they were tired of seeing me probably, but I just was so proud that I could walk, and I was standing upright, and I was just feeling good. 2 days later, he did the second surgery where he went in through the back, and I went home the very next morning, which happened to be my birthday. So the greatest present of all, you know, lots of family and friends come to see how I could walk upright. No more limping, no more leaning, no more, you know, no more taking medicine. I took medicine for the pain of the incision. I've been medication-free since probably about 8 weeks after the surgery. I haven't taken another pill. And I mean, to me it's a miracle. I don't know how I healed so fast, other than this is exactly, it's exactly what Dr. McCord told me it was from the beginning. He said, this is how it's going to be, this is how I'm gonna fix it, and it's gonna take you this little while to heal, and then you're gonna go on and you're gonna go on with life. And I have. I've gone on.